Thank you. Welcome to my channel. We are going to be discussing on questions for the specific pneumonia video we just finished. Please like my video, subscribe to my channel, and share with your friends. Let's go to the question 1. Multiple choice question. Which of the following is the most common bacterial cause of pneumonia? A. Klebsiella pneumoniae. B. Mycoplasma pneumoniae. C. Streptococcus pneumoniae. D. Legionella pneumophila. You're correct. Streptococcus pneumoniae. Which feature is characteristics of pneumococcal pneumoniae on chest X-ray? A. Bilateral cavitating bronchopneumonia. B. Lobar consolidation. C. Reticular nodular shadowing. D. Bibasal consolidation. You're right. Lobar consolidation. 3. Staphylococcus pneumoniae commonly complicates which of the following infection? A. Influenza. B. HIV. C. Tuberculosis. D. Hepatitis B. You're right. Influenza. So, Staphylococcus pneumoniae complicates influenza. Which patient group is most commonly affected by Klebsiella pneumoniae? A. Young children. B. Athletes. C. Elderly. Diabetic and alcoholics. D. Pregnant women. C. Diabetic, elderly, and alcoholics. They are the patient group commonly affected by Klebsiella pneumoniae. 5. Pseudomonas pneumoniae is commonly seen in patients with which condition? A. Chronic obstructive pulmonary disease, bronchiectasis, and cystic fibrosis, diabetes mellitus, tuberculosis. You're right. B. Bronchiectasis and cystic fibrosis. Pseudomonas pneumoniae is commonly seen in patients with bronchiectasis and cystic fibrosis. Which of the following antibiotic is used for Mycoplasma pneumoniae? A. Amoxicillin. B. Clarithromycin. C. Cefuroxime. D. Metronidazole. B. Clarithromycin is the antibiotic used for Mycoplasma pneumoniae. 7. Legionella pneumoniae is commonly acquired from which source? A. Contaminated poultry. B. Air conditioning and water tank. C. Close contact with infected individuals. D. Soil exposure. The correct option is B. Air conditioning and water tank. Legionella pneumoniae is commonly acquired from air conditioning and water tank. Which of the following is the characteristic feature of Chlamydophila pneumoniae infection? A. Biphasic illness with pharyngitis and hoarseness. B. Cavitating pneumonia in upper lobes. C. Endocarditis and splenomegaly. D. Bilateral interstitial infiltrates. You are absolutely right. Biphasic illness with pharyngitis and hoarseness is the characteristic feature of Chlamydophila pneumoniae infection. Which viral infection is most caused by viral pneumonia? A. Cytomegalovirus. B. Measles. C. Influenza. D. Varicella zoster. Correct. Influenza is a viral infection most commonly caused by viral pneumonia. What is the first line treatment of pneumocystis pneumonia? A. Cefotaxime. B. High-dose cotrimoxazole. C. Fluoroquinolone. D. Amoxicillin. You are right. High-dose cotrimazole is the first-line treatment of pneumocystis pneumonia, also known as what? Pneumocystis jirovecii. 11. Pneumococcal pneumonia is dash bacterial pneumonia. 12. Risk factor for pneumococcal pneumonia include early age, alcohol use, and dash. 13. A distinguishing feature of Staphylococcus pneumonia on chest X-ray is dash. 14. In Staphylococcus pneumonia, if methicillin-resistant Staphylococcus aureus MRSA is suspected, that should be considered. 15. Klebsiella pneumonia typically affects dash lobes of the lung. You can do it. 16. Pseudomonas pneumonia commonly occurs in patients with dash and dash. Okay, let's answer the question. I know you're anticipating now, but you're right. 11 is commonest. Pneumococcal pneumonia is the commonest bacterial pneumonia. If you followed my previous video back to back, you'll fill in this gap without stress. 12. Risk factor for pneumococcal pneumonia include elderly age, alcohol use, and immunosuppression. 13 is bilateral cavitating bronchopneumonia. A distinguishing feature of Staphylococcus pneumonia chest X-ray is bilateral cavitating bronchopneumonia. That's for Staphylococcus. Anyway, you see it, bilateral cavitating bronchopneumonia chest X-ray. In Staphylococcus aureus pneumonia, if MSRA is suspected, that should be considered vancomycin. 14. Vancomycin should be considered. 12. 15. Klebsiella pneumonia typically affects dash lobes of the lung, upper lobes, and they are resistant to drug, and you have to add dash and dash, but I won't tell you. Pseudomonas pneumonia commonly occurs in patients with dash and dash, bronchiectasis, and cystic fibrosis. So, Pseudomonas pneumonia occur in patients that has bronchiectasis and cystic fibrosis. 17. For Mycoplasma pneumonia, chest X-ray typically shows dash. Complications of Mycoplasma pneumonia include erythema multiforme and dash. 19. Legionella pneumonia often presents with extrapulmonary features like dash and dash. 17. Reticular nodular shadowing or patchy consolidation. For Mycoplasma pneumonia, chest X-ray typically shows reticular nodular shadowing or patchy consolidation. Complications of Mycoplasma pneumonia include erythema multiforme and Guillain-Barré syndrome. Complications of Mycoplasma pneumonia is erythema multiforme and Guillain-Barré syndrome. 19 is diarrhea or renal failure. Legionella pneumonia often presents with extrapulmonary features like diarrhea or renal failure. The diagnostic test, number 20, the diagnostic test for Legionella pneumonia is dash. 20. Chlamydophila pneumonia spreads via dash transmission. 22. Chlamydophila psittaci is acquired from dash. 23. A characteristic extrapulmonary features of psittacosis is dash. Urine antigen or culture. The diagnostic test for Legionella pneumonia is urine antigen or urine culture. Chlamydophila pneumonia spreads via dash transmission, via person to person transmission. Chlamydophila spreads from